at Stanford Law School right now. Thank you very much for coming. What an inspirational talk you gave. I do want to ask a question. You were talking about global payments, and you were talking about a model of care that did show that they reduced their cost of healthcare spending. They also increased the quality. One concern that I've heard about something like global payments or bundled payments is that potentially physicians start to make less money. And of course, every other country where they do show better healthcare quality, lower cost, physicians are paid a lot less on average than our physicians in this country. And I'm wondering how you rectify that and that sort of necessary thing to happen when we do pay so much more for our education here. I mean, I already have $250,000 of debt, and of course law school is not going to be helping that. But you got to wonder, how do we pay our physicians and justify that decrease?
So, first thing to say is I don't think the approach I've recommended, either whether it's through bundled payments or through global payment, necessarily means doctors are going to be paid less. As a matter of fact, there are many scenarios where doctors are actually paid more. And it depends upon how doctors adjust to the system. That's the first thing. The second thing is, it is true in most European countries, Japan, etc., that doctors there make less than doctors here. Simultaneously, however, our healthcare costs are 50% more than all those other countries. We have plenty of money in the system for doctors to continue to be well paid, and no one is talking about we're going to take our system from $2.8 trillion down to $2 trillion. All of this talk about controlling costs, it's controlling costs. It's controlling how fast we go up, not about going from 2.8 down to 2. That needs to be very clear. How can doctors do better, actually, in a new model system? Well, one of the ways is doctors could actually get paid for all of the things that they do, and if patients don't go into the hospital as frequently, if you don't have complications as much, if you don't have readmissions, there's savings there, some of which can go to the doctors and some of which can go back into the system or go back into people who are paying premiums. And if you look at the ratios, hospitals are about a third of the healthcare spend, and doctors their salaries are about 10 or 12% of the total healthcare spend. You don't have to, if you change payments to hospitals by about 10%, turns out that that's a very big increase in what doctors can earn. It's about a 30% increase in what doctors can earn. So there are many ways by which actually we can control costs, change how we pay, without forcing doctors to have lower salaries.
Over here.